Hello everybody, my name is Marie Kilduff. I'm the Interim Director of the National Clinical Leadership Centre for Nursing and Midwifery, which forms part of the Office of the Nursing and Midwifery Services Director in the HSC. You're all extremely welcome to our 6th webinar entitled Nursing and Midwifery Clinical Leadership during COVID-19, Sharing the Learning from Mental Health Services. Our panel today consists of Ms. Joy John, Assistant Director of Nursing, Dublin North City Mental Health Services. Ms. Ella Townsend, Mental Health Staff Nurse in the Assertive Outreach Community Service in Carlow, Kilkenny Mental Health Services. Ms. Jenny Sinis, Interim Area Director of Nursing, Children and Adolescents Mental Health Services, otherwise known as CAMS, Cork Kerry Community Healthcare. And Ms. Adrian Adams, Registered Advanced Nurse Practitioner in Mental Health, West Cork Mental Health Services. You're all extremely welcome today and thank you for taking the time to join me. I'm going to start with our first panellist today. And as I said, our first panellist is Ms. Joy John. Joy, you're extremely welcome and you are, as we know, the Assistant Director of Nursing in North City Mental Health Services. Joy, I'm going to start with your role and I'd be interested to hear if you could tell me a little bit about your role in mental health nursing services.
Hi, Marie. First of all, I would like to thank you for giving me this opportunity to share my experience with all my colleagues. I work as the Assistant Director of Nursing in Dublin North City Mental Health Services. This services has 2 approved centres based in Connolly Hospital, Blantystown, which is called Department of Psychiatry. We have our psychiatric intensive care unit, which is based in Phoenix Care Centre, which is a regional centre for whole Ireland. And we do provide some community residential services through high, medium and low support hostels as well. All of the services are provided through outpatient department and acute day hospital. My role in the service is to assist the area director of nursing in managing and coordinating the whole service in the area. I do work as a leader in making sure that all the local and strategic plan for the services are being implemented as per the Mental Health Commission guidelines and their regulation, and just make sure that the care that is provided is in line with Mental Health Commission's guidelines and implemented as per the regulations of Mental Health Commission and described in Judgment Support Framework.
It is indeed a very broad role, Joy. I was just thinking that as you were speaking there, it's a very big brief, and I'm just wondering, how did COVID-19 impact on your role?
Marie, COVID came as a bomb to all of us. We didn't have any idea about COVID, and this pandemic just arrived. We were only getting news from Italy or Spain, and nobody had any experience of this COVID. When it arrived and we were getting information through HSC, through NEFIT, and all these guidelines were coming up. So at that time, it was very important to take control the service, to act as a leader, reassure the staff, because staff had mixed feeling of anxiety, fear. They didn't know the exact information. They had the anxiety about the resources. A lot of news were coming about shortage of PPE. So it was very important for the nursing leadership to take control of the service and convey exact and factual information to the staff to make sure that they are aware of whatever changes needs to be implemented. So I'm just going to highlight few changes that we implemented in the whole service in terms of, first will be from staff point of view. Staff were communicated of all our contingency plan. They were included in those plans. We met with the staff reps. We informed the staff through emails, through phone calls, through text messages. We made them, we reassured them about the resources. We reassured them that we have a good supply of all the PPE, and we inform them whatever our plans are in place in terms of service need or for service and going forward. The other important person to be informed was service user and their families. Families were all contacted through various modes of communication, through phone calls, emails for service user to contact the family members. And during that time and post, they had their initiation about free postcard. That came in very handy, and service user contacted their family. So that was one side of the service, to give support to staff and service family as well. The other side of the service was to changes to bring in the service. Like, we have 2 approved centers, so we needed to make sure that any new patients coming to these approved centers should be all safe and should be all protected. So we changed our admission, discharge, and transfer protocols as per the NAFID guidelines, as per Mental Health Commission guidelines. And we identified 2 areas which we made into isolation areas for the approved center, plus isolation areas for the community residential services. We had to identify an area with attached bathroom and toilet so that we can provide them some isolation care over there. And then for the service need, another major changes that we brought in was about redeploying the staff. So all allied and social healthcare staff were brought in, and there was plan made that in terms of a COVID pandemic, in terms of a COVID outbreak, these staffs will be brought into the frontline staff and given them the frontline responsibility. And the other change that we needed to bring was about making sure that staff, any vulnerable staff or any staff which have, which can work from home, or any vulnerable staff can be given this opportunity to work offsite, that we're not bringing them into any infected area, so that they can be working from home. Then another change was, because of this pandemic, we were to stop visiting in the area, and we had to make sure that we should still allow our service user to keep contact with their families. So a lot of digital modes of communications were brought in. We gave them iPads, we gave them tablets, digital advocacy services were brought in. So a lot of changes, significant amount of changes happened during very short space of time. So I just kind of highlighted few to bring to everyone's attention how we managed and how we prepared our service in going forward. Another important thing that we did was to test every service user and staff for COVID-19, even though it didn't give us exact idea for going forward, but it did help us to lessen the anxiety. It did help us to make a plan in going forward and to reassure the staff how we can go forward in terms of controlling this pandemic. So these are a few things that I would like to mention over here. Thanks, Mary.
So Joy, I mean, there was plenty of challenges and plenty of opportunities, and the management of that pandemic fatigue that you speak about, which I know I haven't heard the term before in the webinar series, but it's definitely fitting from what we've all experienced, and we're all feeling that now 9 months into this pandemic. We are feeling that pandemic fatigue. But I'm just wondering, from all of the challenges and the changes in your service, what were the main areas of learning for you and your team?
Mary, we have learned a lot during the last few months. This whole pandemic has been a huge learning curve for all of us, and especially for our staff and ourselves as well. Like, one of the most important things that I would say, being a mental health professional, that we should not forget in all this spending looking after our own mental health, which is very important. We get so used to in dealing with whatever is going on. We try and adapt ourselves in the most effective way, but looking after your own mental health is very important. There's very simple tools to it. Just stay connected with everyone, keep up your healthy routine, whatever way you can communicate with your friends and family, stay connected with them on any healthy routines that you could use in your regular life, at your workplace, going for the walk, having a chat, taking a break. Just keep up with that. You need to stay informed. You need to know what's happening outside, but do make sure that you set a limit to yourself. Don't get too overwhelmed with all the information that is coming upon us. And I would like to mention here about a HSE online program that has been launched this month about minding your own well-being. It is available on HSE website. It provides you very simple tools to look after your own mental health during this pandemic. So I would really stress that if any of us or anyone who would need help can go on those HSE website and take help from this program. And there's a lot of different phone number and contact details also mentioned up over there if someone needs help at any time. Apart from those learning, there's a huge learning that came from service point of view. Mary, like we all have started using these digital platforms, which we never used, e-learning platform, virtual phone, virtual consultations, virtual meetings, that came into service. That is all new learning for every one of us. Lot of service initiatives that we have taken so far, bringing in daily temperature checks, bringing in site preparedness meetings, they were all new learning. And how the whole service have come together, and each and every professional in the service has worked together to get over this pandemic and to help in this pandemic is really appreciating. In the end, I would like to leave a message, and I would like to thank each and every healthcare professional, each and every member working in the front line for all their massive support and hard work that they have put forward. And we do need to keep remember that this pandemic is not over, but it will get over, and we need to keep our guards up. Stay safe, stay connected, and keep everyone protected. That's my message to all my colleagues. Thanks, Marie.
Joy, thank you. And I think that's a really good message to end on. You're bringing in the positive, but you're also bringing in the pieces that we need to think about and to consistently consider in minding our own mental health, and to recognise the pandemic isn't over, but as you said, it will end someday. And just to thank everybody who's involved. So Joy, thank you so much. It's been a pleasure working with you in preparing for today and for having you on the panel today.
Thanks, Marie. Thank you very much for this.
And we're now going to move on to our second panellist today. And our second panellist is Ms. Ella Townsend, who's a mental health staff nurse in the Assertive Outreach Community Service, Carlow, Kilkenny Mental Health Service. Ella, you're extremely welcome here today. And to set the context, I'd just like you to tell us a little bit about your role normally as a mental health nurse.
Okay, thank you so much, Marie, for having me here today. It's a pleasure to be here. Normally, my role as a mental health community nurse involves visiting people in their houses, visiting my service users in their houses, in their homes, which is an honour to be able to do. And because I'm an essential frontline worker, I am entitled to do that. Even at the moment, we do that. So every day, what I would be doing is I'd be visiting my service users in their homes. I would be providing them with medication management. I would be chatting to them. We'd be having conversations about the weather, about anything that was going on in the world at the moment. So the day varies. My days can vary. But the most important part of my day is the visits that I have with all my service users. And what I like to do in the day is to make sure to have a bit of light conversation, to have therapeutic, positive conversations and chats. And I suppose, Marie, that no matter what's going on, I'm there, I'm here to listen, and I'm going to help you as best I can with no matter what I can do. I will do my best to help every person. And I suppose that's something I love about my job, is that I'm in a position where I can help people. And knowing that you can help people in the position you're in is so wonderful. And it gives me such a wonderful sense of satisfaction knowing that I've helped somebody in some way, shape or form throughout my day's work. And I always enjoy that. I'm very blessed to be passionate about mental health and to help others feel good about themselves and their mental health is such an honour for me to be able to do.
And Ella, in terms of your role, because I really hear the connection you have there with service users and how important it is to you to really impact positively on their lives, how has COVID impacted on your role and on your service users?
Well, Marie, COVID has had such an effect on everybody. And I mean, even at the moment, Marie, I've been reading about different situations and the animals in the zoo, and terrible, like it's frightening the way COVID has affected everyone in society. In my own particular case, working with my service users, it has affected them because usually I would be saying to all of my service users, you go to work, you have structure in your day, that you might meet a friend for a cup of coffee or a cup of tea and you'd go out. And I'm always encouraging this. But at the moment, I cannot encourage that, Marie, because what we are doing is we're introducing new behaviour change, new guidelines. And what I am saying is stay safe. The priority now for my service users is stay safe. So that means when you're at home, you stay safe. If someone is coming to your house, you need to make sure that you're protected. And that involves maintaining social distancing if someone is visiting the person. And if the person is going out for groceries or something, that they are going by the guidelines and wearing a face covering, keeping their social distance, and using the hand hygiene that is available everywhere. So things have changed from that point of view, Marie. But things have also changed in terms of how I'm communicating at work. We're now doing conference calls rather than sitting down and doing meetings, which is good in a way too, because we're all in our own offices now and we're all chatting. Whereas before we all had to maybe look at an extra way different at the meeting because we were all face to face. Whereas now we're comfortable in our office and we might have a cup of tea in the background or something like that, you know. So we're adopting very well, I feel, and even taking part in this webinar today and the online, I think we're all adapting to all of that too, because this is how it's going. This is how it's going forward. So we're kind of adopting and introducing everything into our role. As a community nurse, I'm finding that it was challenging, but we are actually getting used to it. And at the moment, I was only out with one of my ladies this morning actually, and she was telling me, God, she said, God, Ellie, do you know what? I've been under so much pressure. Like I was thinking back at this time last year, and I was going here and going there. But things have quietened down for me, she said. I'm actually enjoying this time. And I said, well, what are you doing? How do you enjoy the time in your home? And she said to me, well, Ella, guess what I'm cooking today for dinner, she said to me. And she said, I'm cooking a chicken, she said, a lovely cashew chicken. And I'm really getting into my cooking again. And she said, I'm doing knitting as well. Well, I'm delighted, I said to her, because she's enjoying her home. She's using skills she has always had, Marie. But she forgot about those skills because she was kind of going out maybe for something to eat or meeting a friend for a coffee or something. So she's enjoying her home. And I said, well, that's it. If you're enjoying your home again, that's wonderful, because we have to take the positives out of the situation. The positives at the moment are there. And enjoying your home again, using your skills again, re-evaluating your life and re-evaluating the circumstances as they are, Marie, and taking stock of what is important to life. The important things in life would be our safety and would be our family. So really, I'm having such lovely connections with all my service users. It has changed, certainly with the COVID, it has changed, but we're still having lovely experiences, lovely therapeutic visits and connections. But they're different now, Marie. But at the same time, I think we're all soldiering on and we're all doing very well.
And Ella, just, you know, you've kind of answered a little bit of the next question, which is good because it's a good lead in. But, you know, life has changed. And as you said, for yourselves and the service users and everybody. And I'm just wondering, as a leader working with service users in the community, how can you help them to learn to live with the ongoing impact of the pandemic?
Thank you, Marie. Well, I'm in a good position, Marie, in terms of that I'm out in the community and I'm meeting so many different people on a safe level, of course, social distancing and everything. But I'm in a real good position to foster new ways of living and to introduce this slowly and in a positive way. I'm going to do it at a pace that suits all my service users. So how I can be a leader is I can use my own skills to lead by example, and I'm going to do that in a positive way, gently and positively, and keep doing what we're all supposed to be doing and introduce this very slowly, be a good role model to all those that I visit every day, to my students that I have on placement with me, to all my service users, and also I'm representing the HSE, so even to the public, to look like you're a role model who's doing the right thing. And it's never been more important to me to do the right thing, which is right now. So I'm doing that by leading by example. But secondly, I'm doing it in a compassionate way. No matter what is going on at the moment, everybody will find their own little way of going through this. So I'm also just listening to what's going on. I'm taking in everybody's opinion and being aware of everybody's where they are at the moment. So I'm doing it compassionately, which is the only way I could do it, because everybody has made sacrifices throughout the whole COVID, whether you're not seeing your family, Marie, or whether you're not going to the hairdresser to get your hair done or to get your nails done. We've all made some sort of sacrifices. So I think that it's so important now to just have compassion, and for me to be compassionate to everybody around me, to those I'm working with, to my service users. If I see that someone is maybe having a bad day, asking an open-ended question and giving that person the opportunity to say, God, Ella, I'm not having a good day, and just listen to the person and see how I can help that person. Because as a mental health nurse, I've learned the skills of how to listen to people. I've learned the skills of how to help people, Marie, but also through my own life experience, I feel I have a lot to give to help people as well. And I think we really need to be using all those skills right now, Marie, in order to help everybody around us. And so I will always try my best to keep working on my skills as well, my skill set. And if I can learn from any of the training that goes on to help me, I will take any kind of training to help me be the best person I can be, the best leader I can be, Marie.
And Ella, you know, I'm just hearing what you're saying there, and you know, we've had previous conversations over the last while in preparation for today, and I was really struck by the stories and the narratives you told me in relation to some of the things you use to really help your service users, and I'm sure our listeners would love to hear them. And I'm just particularly remembering the stories about the use of colour, the music, the dancing, and would you like to share that with our listeners?
Thank you. I'd love to share. I am so lucky, Marie, that I've had such positive experiences, as I say. And what I do when I'm going to work is I wear bright clothing, because colour is so powerful, Marie. Even today I have bright clothing on me. And when I'm coming into, there's one lady, when I come into her, she'll say to me, Ella, what have you got on you today? And I'll say the colour, and she'll say, oh my gosh, I love it. I love seeing you coming, Ella. You always brighten up my day, she'll say to me. And then she'll ring me after I've visited. She'd ring me about an hour later and say, Ella, do you know, you're the highlight of my day coming to me, she'll say to me. And it's so lovely. I've had such lovely moments with this particular lady, so I have. And lots of lovely different things that I'm introducing into the day. There was one particular morning where we were together and the radio was on and there was a song on, and it was a beautiful song. It was ABBA. And I said to her, God, I love that song, I said. And she said to me, I love it too. And I said, well, let's sing it then. So she turned it up and we started singing. And before we knew it, Marie, we were just sitting there, the two of us, in the midst of the pandemic, singing ABBA. And it was so lovely. And I said, you couldn't, it was priceless. It was one of those priceless moments, Marie. And it was lovely, so it was. And after that, I was kind of singing for the day. I had a bit of a spring in my step and I was singing for the day, and it was in my head all day. And again, later on, this lady rang me before I was going home, and she said, Ella, do you know, I was singing all day. I was singing that ABBA song all day, and I'm going to keep listening to the music now. So every so often when I come into her home, she'll have the radio on and she'll have a bit of music on. And it's so lovely. Music is so powerful. Sometimes it can be soothing, but sometimes it can really lift our spirits, Marie. And I find that just taking the time to go the extra mile, to find what the person loves to do, and to help the person in a positive way to enjoy that experience. Because right now, Marie, I'm conscious of the fact that this person might not have seen anybody else for the last couple of days or for whatever length of time. And when I go into this person's house, any of my service users' house, for the 15 minutes, for whatever it is, I want to create an experience of positive, therapeutic as possible, so that we can both go away and say, oh, that was lovely, and I feel so much better again. And at the moment, I am feeling that everybody is benefiting, and just from the bit of creative, going a bit the extra mile and being a bit more creative about visits. There's another man actually that I visit that has a little dog, and he loves his dog. And when I'm there, I'll ask him about the dog, and he'll tell me about the dog. And next thing you know, we're talking about dogs. And he's laughing then at me and he's saying, geez, Ella, no one else ever asked me about the dog. And I said, but you know what, sure, I love talking about the dog and you love. So if that's what makes you happy, and he says, Ella, I love my dog. He's my best friend and he's my companion. And it's amazing how there's new ways of living now at the moment. Whether it's finding your dog that you love, whatever it is, the music, the cooking, the knitting, having a bit of colour. There's all these new ways of living at the moment. And moving forward with these new ways of living, I think, is so powerful. And this is the way to go.
Ella, thank you so much for that. And I suppose I'm sitting here smiling, thinking of, and I can see the images of yourself and service users talking about the dog, and then the lady talking about the cooking aspect. And I just really hear someone who really goes the extra mile for service users. And what I'm also hearing is person-centeredness. It's so key in everything you say and you do. So I just want to say that because it's admirable, Ella. I also hear a real key leadership style of compassion and care coming out there. And, communication is very much part of leadership. So we've had many conversations where we've talked about communication, Ella, and we both agreed it's optimal. It's really key for optimal care of our service users. Could you just tell us about your communication and style and how you work with service users, colleagues, etc., and how this has been particularly relevant during the COVID pandemic period?
Thank you, Marie. Well, communicating is so important, and it's never been more important than how it is at the moment, because we are communicating via telephone, via webinars or computers, and social distancing, and also the face coverings, Marie. It's very important that we communicate in a positive, therapeutic way to everybody around us. So at the moment when I'm communicating and I have the face covering on when I'm with my service users, I'm trying to communicate in such a way that will be hopeful for them, and that will be positive and light for the person, and try to make sure to be compassionate when talking and when listening, and giving them the extra opportunity to talk and to listen empathetically and listen with fascination, because it is so important. Listening is so important with communication, and also our body language, Marie. I'm trying to make sure to completely show interest and to be there wholeheartedly with the person, to be present with the service user. And even with regard to my colleagues at work, at the moment we are all feeling this pressure, so it is important that we're conscious of everybody at the moment, and trying to communicate effectively with everybody is so important. All the colleagues, whether it's a student, whether it's junior staff coming on, it is so important now that we communicate effectively in a positive manner. And I think that we are all doing our best, but I suppose trying to be gentle and be patient, and really just be a more of awareness of the value of communication, Marie, I think is so important at the moment.
Well, thank you so much for taking the time to present today. I've really, and I'm sure our listeners have as well, got a really good insight into your role and what you do. And again, to compliment you on the extent that you go to for service users, it's so admirable. So thank you.
Thank you. Thank you, Marie.
I'm now going to move on to our third panellist today, Miss Jenny Sinis, Interim Area Director of Nursing from CAMS, Cork Kerry Community Healthcare. Jenny, you're extremely welcome. And Jenny, I suppose just we've discussed your submission a lot, because I suppose what it really stood out was when you submitted for the webinar participation was that you've taken a really proactive approach to being prepared for the arrival of COVID-19 to Ireland, and it was so admirable. And I know that our listeners would be interested to know, how did you manage to prepare so well and to know what was coming down the line? So I suppose my first question is, could you talk us through about how you went about creating readiness for the immense changes that the pandemic would bring to mental health care nursing in your service?
Hi Marie, thanks so much. A lot of learning. It's great to hear different perspectives from across the country. So this is a great opportunity to share learning. So thank you for that. I suppose from my perspective, I took on the role of emergency management lead for all of Cork and Kerry mental health services. Obviously, this is, as a nurse, this is a huge leadership role. And my role in emergency management first job was really to establish what plans were currently in place in the mental health services to be prepared, be ready for emergencies. All services had good evacuation plans in place. However, given that emergency management is a lot about extreme weather events, at that particular moment in time in November 2019, I sat down with emergency management and drafted a framework to help prepare all our residential settings and our services for extreme weather events. At the same time, so this is kind of all happening around Christmas time. At the same time, if anyone knows me, I have a big interest in flu. And I usually track the Australian flu season, how things are going to be like for us in our flu season. So at the time, I was discussing with a couple of colleagues in Australia about the emergence of this very strange virus that had infected, at this stage, 3 people in a fish market in Wuhan. I remember having a conversation about it at Christmas. So from that, I watched this emerge. From these 3 people in this fish market, I watched it emerge. So I knew that it was coming towards us. It was heading our direction. And given that I was already working on the severe weather plan, I felt the framework would be really good for us to help support staff prepare everywhere for this virus arriving. Obviously, again, from flu, I was very aware of the work of the Health Protection and Surveillance Centre. So I was able to take their advice and, again, my infection control knowledge from being a nurse to work on a similar framework to help us prepare for that.
And I'm just wondering, Jenny, how did you go about implementing the plan? And I suppose I'm particularly interested in the steps you took from a leadership perspective in doing this.
Okay, so I obviously having a plan in place is a good idea, but from a leadership perspective, I needed people to be involved and people to be on board. So I took a collective leadership approach to engage and share responsibility with the mental health services in being ready for the virus. Having an awareness of what was coming due to my interest in flu really meant that I had a gut feeling that things were going to go bad. So I'm also aware that when you introduce improvements as a leader, you really have to have authority and you really have to think about politics. They go hand in hand, really. With regards to implementation, you kind of have to have both, both the authority to make the change, and you also have to make sure you're not going to step on any toes and that you want everyone to be involved. So when I had the first draft of this framework completed, I spoke to the head of service about it, and she could see the benefit in having the plan in place and supported its implementation in all mental health settings. Implementation is also very much for me about engagement, and one of the strategies I use quite a lot with regards to engagement is I'll get people to have input into the draft plan. So I circulated to the nurses to test in the units. I just wanted to make sure it was worked and what didn't work, and maybe I could improve it. So that consultation process also helped with buy-in and to ensure that the staff really took it on board and were really responsible with regards to improvements. The plan really included practical measures such as having a contact list for staff, checking levels of PPE. I did a baseline survey of what PPE was available in all units in early February. We knew hand gel was going to be needed. We knew that the HPSC leaflets were available for staff and young people, and particularly we had a lot of anxiety in our service with regards to young people regarding contracting COVID. The families were worried about if anyone had to be admitted, what the infection control measures were in the unit. Lockdown had a massive impact on the young people's mental health, being stuck at home and sometimes in difficult situations at home. So we kind of knew that coming in, it would be very reassuring to have, we have confidence in how we're managing, we have confidence in how we're coping with it. So certainly from our perspective, we were, happy and confident with the way we were going to manage COVID. And I have to say, overall, there was really good engagement. And in the end, all facilities had sent and completed a good pandemic plan and had returned it to me. So I knew what was available.
It just sounds like you were so ready, I suppose, Jenny, for the emerging crisis, that preparation really helped you. I'm just wondering what challenges and opportunities arose during that time?
Okay, so everything happened with a lot of speed, as all of us are completely and utterly aware. It happened really, really fast. So when you're coming out with a new document, there's usually a big consultation process, a big change management process. I had to be acutely aware of change management strategies, but also that I needed to get the draft framework out, tested, and returned to me as quickly as possible to make sure it worked, to make sure I wasn't missing some things, and make sure it fit with the mental health services. So as I said before, all the plans eventually came back to me, so I was able to put and hold a complete list of what was available in all places. Within this, there was also an opportunity, which there was a lot of learning for me in, that we could develop a mental health services wide pandemic plan. So not only did individual units know how to manage the pandemic, the overall whole mental health services had a pandemic plan in place using exactly the same framework. I sat with the general manager, the head of service, and the business manager to develop this. And this plan helped us ensure core services continue to be delivered. And it helped us prepare for things like bulk swabbing. It helped support the use of telemedicine, something that's helped us maintain service continuity despite the pandemic. And at an area level, this service plan, the pandemic plan, continues to be updated. We use a whole system approach to being prepared and being ready. It was recently reevaluated in preparation for second wave, which actually did hit. We're now in version 21 of this plan, and this has continued to be reviewed as it's considered a live document. And as things emerge and new challenges, we take account for it in the plan.
And as you said, version 21 there, Jenny, I think that really reflects the immense change that has gone on. I mean, change is hand in hand with the pandemic, but just even saying that, the number really makes it real, doesn't it, in terms of changes. Jenny, can I ask you about the learning from the experience, and I suppose particularly how it's impacted on the service of CAMHS?
Okay, yeah. As I said before, kind of within our own area, we're really worried. We knew young people were feeling really concerned about contracting COVID, about becoming unwell. Certainly young people being admitted, being tested was quite difficult for them, but they understood the need to be tested on admission. And really about they would have had a lot of anxiety about coming into a unit and having symptoms. And certainly with the community settings, it was something similar. We were getting that people being stuck at home under lockdown, it was difficult for the young people. And we, with regards our nursing staff, I made sure we had, again, weekly telecalls. We had sometimes twice weekly telecalls with the community nurses. And with regards to inpatient staff, again, we had weekly calls with the nurse management team. So the nurses that were here and the nurses in the community were really well briefed and well prepared for the arrival of COVID. So that really reassured the young people who use our service. I think one of the big things I've learned for myself is from a master's. I remember Tina Joyce telling us, if you think you're communicating enough, then you should. This really taught me the importance of putting a lot of effort into communicating and using kind of multiple communication methods. You know, maybe not just relying on email, relying on looking at face-to-face, looking at phone calls, you know, and trying to be responsive with regards to my communication skills. From a nursing perspective, I felt very strongly with regards operational and organisational sides of service delivery. We understand the practicalities of how services work. I feel this is such a strength, and I don't think it can be underestimated how strong this is for us. So for me, there was plenty of learning from the project with regards to the organisational and balancing organisational and operational sides. Developing a plan and a framework and then scaling it up from unit level to organisational level is something that I take with me ahead and use in all areas of my practice.
Jenny, thank you so much. It's just been so interesting listening about how you developed the plan, implemented it, and the huge benefit it has made to your service. And I'm no doubt people will be asking about it after listening to this webinar. I also really hear that piece around, and thank you to Tina as well. You know, if you think you're communicating, double it. I don't think we can communicate enough. We've heard that from Ella and from Joy as well, and from all of our panelists to date in our webinars. So just thank you so much for taking the time to present today.
Thanks, Marie. Thank you.
I'm now going to move on to our fourth panellist today, Miss Adrian Adams, RAMP in Mental Health, West Cork Mental Health Services. Adrian, you're extremely welcome to the panel today. And I suppose just in terms of the context again, because everybody has different roles on the panel, I would like to just hear a little bit about your role and again, how COVID has affected your role, Adrian, during the pandemic and during the past year.
Thank you very much for having me here. It's lovely to be able to talk about this. I'm an advanced nurse practitioner since 2012, and I suppose I've been in clinical practice since 2003. My recent role is that I've been involved in setting up a clinic in 2016 with allied professionals, where we run an open dialogue clinic where we meet with service users and their social networks. So we work in teams of 2. So the important key to our work really is that social network, when service users presents for assessment, that we encourage them to bring in whoever supports them through the crisis and who supports them when they're well as well. So that's my main role at the moment.
And in terms of COVID, Adrian, how did that change during the pandemic?
Well, it literally changed overnight. We went from not meeting families initially to literally going online, and we were very fortunate at the time that we had one of our team leaders actually had an encrypted Zoom, which meant that there was no delay, in the sense that we were able to actually start online video links with service users that could engage with internet access. So literally overnight, telephone calls, teleconferencing, where we held our weekly meetings, that changed. We had to do everything through teleconferencing. So literally overnight, we kind of literally went into isolation, and also having to check for, COVID symptoms, having to wear masks, having to clean down furniture. We realized that some of the rooms weren't suitable for meeting service users on their network. So the whole thing changed overnight. But the positive thing out of that as well is that we literally went back into the community. We went visiting people at home. When the weather was good, we sat in their gardens with them and social distance. So there was a lot of positives out of it as well.
And Adrian, I suppose, in the last year, we've heard so much about mental health, and even in terms of the government's decisions whether to move into different phases of lockdown, there was always that consideration because it's so important for everybody. And I suppose particularly for service users and mental health services. Can you talk to us about how COVID-19 has impacted on service users, and particularly around how you managed to support them with the challenges they faced?
I mean, it had a huge impact on service users, in the sense that even though, initially when the lockdown came, there was less referrals coming into our sector. But actually that wasn't a reflection of people suffering. Service users and people that were presenting with mental health issues were afraid to leave their homes. And they actually were, when you did engage them, they were afraid to go to their GPs because they weren't sure what was happening. And in some way, they felt maybe that, having their needs mightn't be as important as the COVID-19 needs. So really, even though we had less referrals, we're very conscious that service users were isolated. We work in a very rural area, in West Cork. So, people to come into clinics weren't coming in. So it was very important to reach out, very important to phone, even phone. There was more pressure on us to make more phone calls, because some of our service users were the older generation. They didn't engage with internet. They didn't have a laptop. They didn't know. They would have a Nokia phone. They wouldn't have a video on their phone. So that contact was hugely important, because they were socially isolated. So there was more pressure on us as mental health professionals to keep that going, and to actually for us as staff to keep motivated in doing that. So that was a big. And then the younger, the more, maybe my own age and younger, I won't say what age I am, it was probably a bit easier for us to engage in the internet access. They had the smartphone, they had the laptop, so they were able to engage straight away. And I suppose what really benefited as well, from the NPDU at the time, is that we were set up straight away with Attend Anywhere. As a nurse, I was able to accept that straight away. So I think we really need to look at, even though service users might not be coming in, doesn't mean that they're well. We have to reach out and keep in contact with them.
And I'm really hearing, Adrian, through the different ways you did that, particularly with the older generations and going to them, having conversations in the garden, which was so important for them. And then using that internet connection with the younger generations that are more fay with social media, etc. And as I just also heard you saying there, Adrian, in the beginning, with the impact of COVID, you mentioned the word isolation, and this was a massive change to you and your team. And I'm wondering, could you talk to me about how the pandemic has impacted on you and your colleagues?
I actually brought this question to our team on Tuesday when I said I was doing this webinar, and I asked them to kind of, can we talk a bit about this? And, it really has had a huge impact on us as a team. Like one of the OT, the occupational therapist said, not meeting people, not meeting your colleagues. I mean, it's going against everything. We're in relationships, and not being able to, just have that cup of tea with your colleague, along the or to have a chat, even the physical contact, the wave, or, sometimes if somebody's upset, that you can hug them. That just, even with your own colleagues, you couldn't do that. You literally had to step back. And they said it had a huge impact. And even though the internet was great to have it, but you cannot replace that face-to-face contact, because in a room, that embodiment of being with someone is so important. So it had a huge impact. And even myself, the social isolation, because often, I worked from home. I could spend maybe 4 or 5 hours a day doing Zoom calls, doing phone calls, and not meeting one colleague in all that day, sitting down in front of a laptop. So that's social isolation, and we felt that as a team as well. But I think the one thing that really stood to us is that when we developed the clinic back in 2016, we inbuilt a peer support supervision meeting every week. So we had that meet where we met face to face during the clinic, that we made time, that we sat down as a team and spoke about the impact of the work on us, and the impact more or less about how it was impacting us, not talking about the people that we were working with. And I think when we went into the COVID-19, we automatically put that online. We ensured that continued. And we often spoke about over the last couple of months how that meeting is crucial to our mental health, and how we were able to keep that meeting going all through, and still are through the whole pandemic. We still meet once a week for an hour and a half, where we engage, we talk about how we are, how the work is impacting on us. And I think that really was, in hindsight, that was crucial, and how that had really benefited us going forward.
And Adrian, when we spoke about that peer supervision ourselves, I suppose what really struck me was that safe space.
Yeah.
And that place where you could feel very safe and confident that whatever you were saying was in a confidential setting.
Yeah.
And it sounds like a really, really important aspect to managing and minding yourselves as colleagues in mental health. So it's something that I think others listening could think about for their own services nationally if they don't have this already. Yeah. Adrian, just like the other panelists, and I think it's really it's wonderful to have you all here today with your mental health expertise for everybody. But I suppose as an AMP in mental health service, you're in an ideal position as a very senior leader from a clinical perspective as well, to support us and to support listeners in answering the question of how can healthcare professionals mind their mental health during a pandemic such as COVID-19.
We've reflected a lot on this, and for me, I think it's really important that we are compassionate towards ourselves. Really have compassion towards ourselves. This is really difficult work, and mental health is really challenging because it's all about communication. And just to take a step back and think, this is unprecedented times, and we're working in very challenging times, and really to have that compassion for ourselves. And there will be days when we won't feel great at work. There will be days where I have felt totally exhausted, and to say that's okay. Ring your colleague, talk to your colleague on the phone, which we have done. And when your colleague says to you, I am really not motivated today, Adrian, I'm really struggling, that's okay. It's okay, because we're isolated. We're not meeting our colleagues. We're not doing that, what we always did. That the relational piece, the connection, is so important in any dilemma, in any pandemic. It's so important to be connected to your peers and even to your family. So I would say be compassionate towards yourself, and it's okay to have a bad day. It's okay sometimes not to feel great, and to, the day is long, even to take mini breaks during the day, walk away, go out and just stretch your legs, during the day, stretch yourselves walk away from the computer. But just that compassion is so important to us, because sometimes we don't give ourselves enough compassion as mental health professionals. We don't allow it. Sometimes we just keep pushing ourselves. So I think for me, that has really come home to me, is that it's okay not to be okay.
And I think that's a really key message at the end of your piece, Adrian. Thank you so much. I think it's a very good message for everybody listening. Thank you for taking the time to present today.
Thank you.
And I'd now like to hand over to my colleague, Dr. Clare Lewis. And Dr. Clare Lewis has been taking notes throughout the webinar and will now present the key findings. Thank you, Clare.
Thank you, Marie, and thank you to all our panel today. It's been absolutely wonderful to hear the level of innovation and leadership, and very much underpins the principles of policy, sharing the vision and mental health policy for everyone, those core values and service delivery principles around promotion, service access, social inclusion and continuous improvement. So just to begin with joy, it was really interesting to see how they used work to organise the mobilisation of care, and everybody was very clear on their roles and responsibilities and the importance of communication to staff and updating on the situation as it evolved, and looking at the process of care was very important through admission, transfer and discharge, and reconfiguring the services to respond to the needs of the service users and to protect those accessing care and the staff, and to see how new ways of working evolved, so the use of digitally enabled methods to ensure families could stay connected. And what was very clear was the importance of every one of us minding our own mental health, staying connected and keeping active. And it was interesting to hear about minding your well-being, the HSE programme that's accessible to all staff through the HSE website. With Ella, it was really very heartwarming for me to hear about that real life community experience and assisting people to live their best life and promoting wellness, and how that she and her colleagues capitalised on that good therapeutic engagement to adapt to the situation that we found ourselves in and to support people who are experiencing anxiety and reducing levels of anxiety due to the pandemic, and how technology has really helped her role and her team to engage service users and to keep updated on training. What was very strong was how Ella used her own values and had such a positive outlook on life to therapeutically help service users, and use music therapy, the use of colour, so very visible to support service users, and being present, listening, not just to service users, but to our own colleagues, and that real compassionate leadership came through. With Jenny, it was fantastic to hear how she'd actually looked at the international landscape as part of looking at readiness and creating that readiness to respond, and developing and the implementation of a framework to support staff preparedness. And there was very much that collective leadership to engage with key stakeholders to implement the plan, and the key steps, so the clarity that was required on governance, accountability to direct the plan and protect service users and staff, so that level of integration across services that were required, and how important that information to support young people and staff through the pandemic, and the importance of mapping the resources that were required to implement the preparedness plan. And it was very much a whole system approach, and it's an agile document, it's a living document that adapts and adopts to the situation, and communication was absolutely essential to prepare staff and to support young people. And just finally, with Adrian, as an advanced nurse practitioner, she very much was the advocate for patients and having for service users, and having that open dialogue clinic, capitalising on the social network and support for service users, and transitioning onto virtual care, and embedding new practices very much about infection prevention and control, the importance of engagement outdoors, and recognising the anxiety levels that are out there for service users in accessing service, and the importance of reaching out because of the isolation that's been created, and not just for service users but staff isolation, because we're having limited contact with colleagues, and having that therapeutic engagement with one another. And it was fantastic to hear about that peer support supervision group. But was very much is what came through with what Adrian was discussing was around having compassion for ourselves and the practical measures that we need. So connectivity, time away, going for a walk, keeping active was absolutely wonderful to hear. So just to conclude, it was a fantastic panel expert panel discussion today. And what really has come through is how they're striving to create a mental health system that addresses the needs of the population with accessibility and support. So thank you to our expert panel today. Thank you very much.
Thank you, Claire, and I'd like to echo what you said. I'd just like to thank all of our panelists today for the time they've taken to prepare and for presenting today. It's been absolutely excellent to hear your clinical leadership experiences during COVID-19 and the ongoing clinical leadership that you're demonstrating and that real connection with service users. So thank you all very, very much. In terms of the webinar series, we will be taking a break from this series until January 2021. On behalf of the NCLC, the Chief Nursing Office and the Institutional Leadership, RCSI, I'd like to take this opportunity to wish everyone a very peaceful and happy festive season. It has certainly been a very challenging year and it will be a very different Christmas for many, but I would urge everyone to take time for yourself over the holiday period, and I really do hope 2021 brings happiness, peace and an end to the pandemic. Our next webinar will be Nursing and Midwifery Clinical Leadership during COVID-19, sharing the learning from intellectual disability services. And we will be circulating that webinar on the 13th of January 2021. Thank you.